The Wingate at Needham on Highland Ave is seeking the conversion of its existing 142-bed skilled nursing facility to 50 senior independent living units. At the Planning Board meeting on March 1st, town officials and Wingate representatives discussed the current challenges for the skilled nursing industry and what it means for the Needham elderly and their families.
Citing data from the Centers for Medicare and Medicaid Services, Wingate Vice President of Real Estate David Feldman said the skilled nursing industry is experiencing an extremely low occupancy rate.
There were over 8,400 open beds across the state, almost 1,100 open beds in Norfolk County alone.
Feldman said nursing homes are losing patients to home care companies.
The same services you would get at Wingate at Needham or other skilled nursing facilities, including home health aides, similar to a certified nursing assistant. But in the comfort of your home, home care is clearly the preferred option.
Feldman also pointed out the COVID-19 pandemic has exacerbated the staffing challenge.
We were hoping that coming out of the expiration of the additional unemployment payments, people would start to come back to work. We have not seen that. We have raised rates numerous times. We are paying agency to provide care, which is not ideal. We are paying overtime for our existing staff.
The new program will include studios, one-bedroom and two-bedroom apartments with 4 kitchens, washers, and dryers. The Needham Public Health Division expressed concerns about the proposed changes. In its letter to the Planning Board, Director Tim McDonald wrote, "This change would place an undue burden on the residents of Wingate and on their families as they struggle to find placement for their loved ones in Needham or in surrounding communities." Feldman talked about how Wingate would help with the relocations of their clients.
Our social service teams meets with families to discuss choices. If a family has a home already selected, Wingate will work with that facility to make sure the transfer process is as smooth as possible. If a family does not have a location selected, social services will make a recommendation of 2 to 3 facilities within a 25-mile radius of Needham and schedule tours for the families to tour the home and meet with the care team. If a family would like to relocate the resident outside the 25-mile radius, someplace closer to another family member, social services will provide 2 or 3 choices in that area and schedule tours for the family at that home and meet with their care team.
Feldman said it is likely that by the end of April, Wingate will complete the transferring of its residents. McDonald referred to the closure of Avery Manor and Avery Crossing 4 years ago, pointing out many residents were transferred to Wingate at that time because of its proximity.
It has a real impact on the person in the facility, and it has a real impact on the family when they have to go to Foxborough instead of Needham, or even if they're only going to Walpole. That's a big difference, a 5-minute ride versus a 35 or 40-minute ride. I do wonder, given the experience that the town has had and the impact that it had on town residents at Avery, whether Wingate could make a commitment to, and I think it would be a question of how, to make sure that there is a better, maybe more comprehensive transition plan for residents. I know there are state mandates on how that works, but maybe there's a way they could commit some extra resources to make sure that there are placements that leave the residents, as satisfied as possible with their situation.
In response to an attendee's question about pricing, Feldman said the residences would range between $3,000 to $4,000 a month. For the Needham Channel News, I'm Yu Xiaoyuan.